Good morning. My name is Warren Newton, and I serve as the President and CEO of the American Board of Family Medicine Foundation. This year, the ABFM Foundation is delighted to present the PCC Advanced Primary Care Practice Award for 2021. Everyone watching this video understands how challenging it is to put together a transformative primary care practice in these times. From fee-for-service that is persistent and challenging, from systems that are actually non-systems and tend to disintegrate care, to many competing demands, particularly under COVID. This is a very difficult time to develop primary care practices. At the same time, it is critically important to recognize them for the vision necessary to put them together, to recognize them for the principled pragmatism that they have to adopt over many years, and to recognize them for the sheer tenacity of will to put practice together to develop teams over time. It is also important to recognize them for ourselves. Practices like this give those of us working in the vineyards hope. They give us an idea of what can become if we work together, and we work hard, and we work with vision. So in that setting, it's my honor to present this year's 2021 Advanced Primary Care Practice Award of the Year to the Westminster Medical Clinic. Now we would like to hear the testimonials from those who would describe the clinics, and we can see them through their eyes.
Hi, I'm Scott Hammond. I was a family physician for 35 years at Westminster Medical Clinic. I'm currently the president of Primary Care Consultants and also president and founder of a nonprofit, the Colorado Center for Primary Care Innovation. I recall an NCQA conference back in 2009 where Paul Grundy had a call for action for the patient-centered medical home. And Westminster Medical Clinic took up that torch. In fact, in 2003, I'd already been doing the chronic care, Ed Wagner's chronic care model, but in 2009 became the second patient-centered medical home in Colorado, progressing to care coordination, and then developing a working medical neighborhood that actually spread nationally, finally landing on Bodenheimer's advanced team care model, where they incorporated behavioral health, physical therapy, health coaching, pharmacy, personalized medicine, all in concert and with the Patient Advisory Council. Along the way, tackling the wicked problems that really only primary care and family medicine can address: health literacy, opioid addiction, cancer survivorship, serious illness conversation, and most currently, the loneliness epidemic. Along the way, paying attention to wellness not only of the patients, but also of the staff and providers. Congratulations, Westminster Medical Clinic. For 15 years, you have been working incredibly hard to provide the care that this country desperately needs, that we want to provide our patients, our families. You've persevered, and this is your time to shine. Congratulations, you've just done a wonderful job, and certainly a model for others.
Hi there. Have you ever dreamed about something different, new, or better care for your patient? What about how to connect meaning to the work, enjoy patients, and enjoy one another? Maybe it sounds too good to be true, but here at Westminster Medical Clinic, our entire care team dreams, adds a plan, and uses individual strengths to make what seems impossible possible. Westminster Medical Clinic was established in 1952, and today the clinic is providing care in suburban America as an independently owned and operated family medicine clinic. We have the opportunity to offer the right care and services that we believe are significant in both our patients' lives and our own. While we ask patients, what is the matter with you? We also ask, what matters most to you? How can we be more collaborative as a team for both patients and with one another? Team-based care is the only way to offer care built on the foundations of medicine. As a few examples, interdisciplinary teams get to meet monthly to build shared care plans. Staff have unlimited mental health benefits, opportunities to grow and develop a shared purpose. Both clinical collaboration and administrative relationships are necessary. I'm Caitlin Barba, a mom, a wife, and practice administrator and co-owner of Westminster Medical Clinic with Dr. Robin Smith, our current president, medical director, fearless leader, and clinical leader. I've had the pleasure of working with Dr. Scott Hammond, medical emeritus. We are a family medicine family, taking care of individuals and families in sickness and in health, in healing and well-being. All of this to say, our hope for the future is that we can inspire new physicians and providers in family medicine to aspire for independent practice and the impact that is possible in care delivery. This award is deserving and a very special recognition of the professional, curious, ultra-caring team at Westminster Medical Clinic. They are the ones to be honored, and I'm so grateful to get to work with them. Thank you all.
I'm Bev Johnson, President and CEO of the Institute for Patient and Family-Centered Care, and have been pleased to serve on the PCC board since 2012. I'm deeply honored to be asked to present PCC's 2021 Advanced Primary Care Practice Award. This award is presented to an organization that is an extraordinary primary care practice. Practices that have been recipients of this award serve as a model for transformation through innovation, as reflected in the shared principles of primary care, including patient and family-centered care, team-based care, and high value. As we move forward as a nation to further invest in primary care and build a truly robust system of primary care, we need to learn from the Westminster Medical Clinic in Westminster, Colorado, this year's distinguished recipient of this prestigious award. Westminster Medical Clinic is an independently owned practice that has assembled an extraordinary interdisciplinary team serving over 6,500 people in its surrounding communities. With discipline and heart, this family medicine practice has been an early adopter of best practices and continually implemented them into the core of the way they work. Barbara Starfield's fundamentals, Beauchamp's values of medicine, the chronic care model, the medical home standards, and more recently, the shared principles. While the practice has benefited from its visionary, committed clinical leaders, it has also benefited from having a practice manager with a master's in public health who shares the core values of the practice and helps to implement them. Westminster Medical Clinic sets an inspiring example for the future of primary care.
So now please join me in congratulating Westminster Medical Clinic for their remarkable achievement.
My name is Robin Smith. I'm the medical director, president, and co-owner of Westminster Medical Clinic. On behalf of everyone here at the clinic, I am so proud to be able to accept this wonderful award. When thinking about how best to describe who and what we are here at the clinic, I think about the little engine that can and that will. When we see a mountain, we know to use the entire team to get to the top. The best way to describe how we use our care teams is during our care coordination meetings. In these meetings, we use front desk, MAs, behavioral health, health coach, pharmacist, healthcare coordinators, and practitioners. During these meetings, we try to decide who would benefit best from each team member. such as having the pharmacist do a comprehensive medication analysis, or meeting with our nurse practitioner at home for safety evaluations and to start discussing serious illness conversations, or meeting with our clinical pharmacist to discuss comprehensive medication management or do an opioid taper plan. We also then make a recommendation for health coaching, where patients can learn lifestyle changes for diet modification, exercise, and weight loss. We discuss with our behavioral health specialists how best to help the patient through their mental health needs by using the entire team and having the entire team understand their needs. We also then use our newly formed healthcare coordinators who take these care plans and make sure that we're all following the plan as we have outlined it. We decide on how frequently the patient should be seen. We also all share one office, which we call the bullpen. This is where we're all able to collaborate and support one another every day. In conclusion, I would like to thank PCC for bestowing this wonderful honor upon the clinic. And most importantly, I want to thank my staff. You are an amazing group of people, and I am proud and honored to be able to work with you. It is because of you that this honor was bestowed upon us. And for that, I thank you and I love you.